Yes, good afternoon, good morning, depending on where you are. For those in Uganda, good morning and welcome. This is the Uganda's health care market at tour webinar that we are looking at, and I hope people are able to see me or hear from me. Yes, good morning and good afternoon. Welcome. I understand now I can be seen. Thank you for confirming that you can see me. And would like to start this meeting. I don't know whether we have any guidance related to how you want us to move. Okay, let's proceed as we start to this meeting. Today we have an interesting day, and the key things for our agenda. We are going to look at the Uganda's healthcare market at an inflection point, looking at capital, digital transformation, and scale. We are happy to note that we shall have Dr. Patrick Luaga, the chair of UHF, join us as we start this meeting. But before that, we are going to have some remarks from our hosts. My name is Robert Mugera. I work with the Ministry of Health. I'm in charge of private sector coordination, and I'm delighted to be your moderator for today. So I would like to hand over to Unique Global right now for them to share some highlights. Over to you, Unique Global. Rahel, hope you can hear me and you are ready to proceed. Just as we wait, George from Unique Global to proceed with our meeting, we just wanted to highlight on the key issues and the objectives for this meeting, what we do expect to happen out of this webinar. Alongside this webinar, we want to discuss. We are going to be discussing a few of our the objectives related to Uganda's healthcare market. And with this, Dr. Ruaga will be giving a keynote a keynote address, and within this, we shall have the capital, digital transformation, and scale of such interventions. But along the way, we are also delighted to note that audiences will be given an opportunity to share their experiences, ask questions going forward. We shall also have a panel discussion. The discussion will focus on access to capital. I think this is important, and we would want to look at why growth is stalling. And we shall be looking at exploring funding gaps, investment readiness, the curated deal for opportunities. So we are Dr. Miriam Motero will be leading us, will be part of this panel, and hopefully all will be set. And then in our panel session 2 will be also presented by Judy Mugoya. This Judy Mugoya is from Smart Applications International, and the focus will be on digital health adoption, bridging the integration gap, addressing systematic barriers to digital transformation, and partnership models. So as we prepare to move forward, I would like now once again to invite George to come and give a brief on the objectives of this meeting from Unique Global. George, over to you.
And thank you all for joining us today for this exciting event. My name is Josh Kessie, and I have the privilege of opening this event on behalf of Unique Global Advisory Firm, and we are dedicated to improving the healthcare of Africans and African organizations by assisting them in market entry and growth across the different African countries. My privilege today extends to the event that we are having in Uganda as the Uganda Health Market Tour in June. And this is based on our experience over the years of similar events across different countries. In particular, is the roadshow that we hosted in Ghana exactly a year ago in March 2025. And out of that roadshow, we had a lot of experience sharing stories with other African healthcare providers and service providers across the different spectrum of the value chain. And through that, we've realized three commonalities across the healthcare chain in Africa. One of them is definitely the lack of access to private capital. We are all aware of the dwindling resources from developmental organizations to healthcare services in Africa. But that also provides another opportunity for private capital to step in and to be roped in as part of the workings of our healthcare services across Africa. How do we make that conversion? How do we switch from development dependency, capital dependency in our Africa healthcare system? So those conversations are part of what drives our initiative for today. How do healthcare companies and businesses pivot around the existing capital base that we have and the existing digital innovation space that is occurring across Africa to achieve sustainable growth and to also be better at the service that they provide to our people? So these are the conversations that Unique Global drives across the different African countries. And today our focus is on Uganda. And we are very esteemed to have these highly experienced and skilled professionals to have that discussion with us and to open our minds to other aspects of growth in Africa that we have not considered or we are yet to consider. So today's topic, which is Uganda's healthcare market at an inflection point, capital, digital transformation, and scale, is one that we are going to dive into with particular emphasis on access to capital, digital health adoption, and how to survive and expand across the different markets, especially in pharmaceuticals. So I'm very happy and glad to be part of this webinar. And I know definitely by the end of our session today, there'll be a lot of chewing on we have to do at the main event happening in June in Uganda. I thank you all for being part of this, and I will hand you over back to our moderator. Robert, thank you very much.
I think you made the objectives very clear, and in regards to why we are here, and would want to take this opportunity first to thank you for considering Uganda as a country of choice for this event, and we promise that as individuals we are excited and looking forward to the next steps. So at this particular time, ladies and gentlemen, want to introduce um, our keynote speaker. This is from Dr. Patrick Ruaga, the chair of Uganda Healthcare Federation. Uganda Healthcare Federation, as you will note, as you will note, Uganda Healthcare Federation is an association of associations. It is supporting the Ministry of Health in the coordination of high-level private sector, and within this, they coordinate clinics, drug shops, pharmaceuticals. They are also supporting in the coordination of last mile service delivery to clinics and also to drug shops. So it's important that as we get into the discussion, how do we, in this moment where we are looking at sustainability and ensuring that as the reduced funding is towards us, how do we sustain ourselves as the private sector? So this morning, once again, Dr. Patrick Ruaga will be taking us through the session. And ladies and gentlemen, I want us to welcome Dr. Ruaga as he shares his note speech.
Good morning. Can I be? Is all well? Am I visible and am I heard? Hello? Hello? Hello?
Dr. Ruaga, I just wanted to tell you that we can see you and we can hear you.
Oh,
All
okay.
is set. Yes.
Okay, great. Yeah, it's a great honor for me to be part of this event, and I hope the protocol has been established. If not, if so, then I'd like to ride on the protocol. But if not, then distinguished leaders from the Ministry of Health, our partners, Unique Global, and all colleagues from the private health sector in Uganda, and all those that online, UHF membership, dear global collaborators, investors, innovators, and colleagues. I'm honored to be here this morning to say a few words about our topic today, Uganda healthcare market at an inflection point regarding capital, digital, and digital transformation and scale. Yeah, I'm honored to be here at a time when our health market is no longer merely emerging, it is evolving, accelerating, and approaching a critical inflection point. The choices we make now will determine whether Uganda or any of the countries involved become a regional leader in resilient, equitable, and high-quality state-of-the-art healthcare, or whether we allow fragmentation, underinvestment, and missed opportunities to slow our progress. So today, I want, as the organizers have arranged, to speak about the forces shaping the inflection point, capital, digital transformation, and scale, and why aligning these forces with purpose and partnership is a task of our generation, you and me. Just a few highlights. When we talk about Uganda health market, there is potential for growth. It's our system here is mixed, both public and private. Regarding the pharmaceutical side, as you'll hear later, we are net importers of pharmaceutical products. There is a high demand for private medical services. We still need to build our infrastructure and investments. We definitely need to develop our workforce better, and we will always remind you that demographically, Uganda is mainly a population of the youth, and we are faced now with a dual disease burden, particularly with the growing non-communicable diseases in addition to the infectious diseases. And we still have low penetration of health insurance, and in terms of financing of our health, we are about halfway the Abuja Declaration of $15 per capita. Now, going back to the main subject, Uganda healthcare reality is characterized by progress and pressure, which is true in all regions. We do have progress, and then, of course, this is against the pressures. Uganda has made undeniable gains over the past decades, expanded primary care and improved immunization coverage, and growing private health sector, and a vibrant community of health professionals that have saved lives and strengthened the trust in the system. The private sector now delivers significant share of outpatient care, diagnosis, pharmaceuticals, and specialized services, far from filling the gaps where public provision is stretched. Yet progress exists alongside profound pressure. So the pressures, our population is young, rapidly growing, with urbanization accelerating. The burden of disease is shifting from communicable disease to a complex mix that includes non-communicable diseases. Mental health, though usually underplayed, is also something that is cropping up. Trauma, climate-related health risks. At the same time, health financing remains constrained, with the supply chains rather fragile, and health workers are often stretched, leave alone our brain drain. So that this tension between rising demand and limited capacity is exactly what defines an inflection point. It is also but also we must emphatically note that it's what creates the opportunities. So regarding capital, we can consider it from short-term funding to long-term value. So Uganda's healthcare market does not suffer from lack of need. It suffers from lack for fit for purpose capital. Too often, health enterprises rely on short-term high-cost financing, and it's misaligned with the realities of healthcare delivery. Health is not quick, it's not a quick return commodity. It is a long social and economic investment. We must therefore reframe healthcare investment in Uganda as a strategic infrastructure and avoid tendencies towards charitable expenditure. So this means, one, blended finance models that combine public funds, public funds, concessional capital, private equity, and or philanthropic investment to de-risk innovation and expansion. Number two, we must work towards patient capital. What do I mean? That this is what recognizes the time it takes to build quality, trust, and also scale in healthcare. And number three, outcome-linked financing. And around here, we commonly are familiar with risk-based, results-based financing. This may be more familiar, at least in Uganda, where returns are tied not only to profit, but to measurable improvements in access, quality, and equity. So for young global investors, other investors and partners listening to us today in this region and beyond, Uganda offers something rare: a growing market, strong human capital, and a chance to shape a system before inefficiencies become entrenched. For local providers and entrepreneurs, the task is to build transparent, well-governed institutions that can absorb and deploy capital responsibly. When aligned with public health goals, it becomes a force multiplier. When misaligned, it becomes an extractive. We have seen a lot of efforts by Minister of Health, as usual. We can do with more, certainly, and we must make this choice. We must make the choice Now, as regards digital transformation, the second force shaping our inflection and our discussion this morning is digital transformation. Across Uganda, we see promising digital health initiatives, electronic medical records, mobile health applications, telemedicine, medicine pilots, digital supply chain tools, but too many of these remain fragmented, sometimes donor-driven or disconnected from national systems. Digital transformation is not about technology alone. It is about reimagining how care delivered, financed, and governed. To move from pilot platforms, we must focus on three priorities. One, interoperability. Digital tools must speak to each other and align with national health information systems. Fragmentation wastes resources and limits impact. The second is data as a public good. Health data, securely managed and ethically governed, can improve clinical decision-making, strengthen surveillance, reduce fraud, and guide investment, but above all, drive policy decisions. But this requires trust, clear regulation, and shared standards. The third one, digital inclusion. Technology must serve rural communities, informal settlements, and marginalized populations, not just the urban elite. Solutions designed for Uganda's realities, low bandwidth, variable literacy, community health workers will be our most scalable innovations. Digital health is also a bridge between public and private sectors. When aligned with policy leadership from the Ministry of Health, digital platforms can harmonize service delivery, improve referrals, and strengthen accountability and portability across the entire systems. Now, going to scale. I will not limit myself to pharmaceutical, which is the subject of this, but I'll look at this in general. And scaling healthcare is not the same as scaling retail or telecommunications. In health, scale without quality harms the lives. Scale with equity deepens inequality. Scale without regulations erodes trust. Yet without scale, we cannot meet national demands. Uganda's private health sector must therefore pursue responsible scale, expanding reach while embedding quality, affordability, and ethics at the core. This means that standardizing clinical operation practice across facilities, investing in health workforce development, not just infrastructure, leveraging networks and group purchase to reduce costs, and partnering with government to extend services into underserved regions, etc., 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 etc. If we had time, we'd go into more of this. Scale also requires regional thinking. Uganda is strategically positioned within the East African and cross-border care within East Africa. Cross-border care, regional supply chains, shared training platforms, and harmonized regulation can unlock economies of scale far beyond our national borders. Partnership, I would emphasize, is the only way forward. None of this capital, digital transformation or scale can succeed in isolation. Government must provide clear policy direction, stewardship, and regulatory certainty. The private sector must bring innovation, efficiency, investment discipline, development partners, and our colleagues that are going to work with us must move from particular projects to system strengthening, global collaboration, and engage as long-term partners, not short-term contractors. And above all, patients and communities must remain at the center. A health system that grows but leaves people behind has failed, no matter how impressive its balance sheet or technologies. So, ladies and gentlemen, a call to action. We are standing at a moment of choice. We can continue with fragmented growth, undercapitalized providers, and disconnected digital experiments, or we can align our capital with purpose, technology with people, and scale with equity. Uganda's healthcare market is not just an inflection point, it is at a moment of possibility. If we act with vision, courage, collaboration, and can build a healthcare system that is resilient to shocks, attractive to investment, and grounded in equity, and capable of serving generations to come. This should be our contribution to attaining universal health coverage by 2030, our contribution to our regional health, and the African Vision 20, I think 26, the Africa we want. That is the vision, the African vision. Let us be counted as leaders who recognize this moment and rose to meet it. Ladies and gentlemen, I thank you for listening to me, and I'm looking forward to a very fruitful and insightful deliberations. I would like to thank you and stop there for God and my country.
Thank you so much, Dr. Waga. Thank you so much. It's such an interesting submission, and we really do appreciate. Thank you. Thank you. And there's a lot to learn, especially with your wealth of knowledge and given the guidance and what has been shared. We just want to give an opportunity to anyone who has a question, a comment. You have a question. Rahel, I don't know whether there are some questions in the comment section. Otherwise, we are delighted to continue moving. And I think there are some key take homes as under digitalization. I am delighted that the recommendations are in line with what the Ministry of Health is guiding. That going forward, it's going to be very difficult for us to have paper. We need to see that our digital tools are speaking to each other. They are integrated into the DHIS tool. That our contribution as private sector is very clear, and we are able to see this covered. But the other key thing is that data is taking data as a public good is a key factor of concern, and we know now data is the new gold. Wherever we are, we must be able to keep the data very well. And I think private sector contributes almost 70% of the available data, and this is something of consideration. But as we scale the responsibility of government to ensure that they regulate and provide policies, guidelines, but also provide an enabling environment. I'm saying all this with giving you an opportunity in case you have a question, you have a comment that you want to make. Otherwise, we want to go in details in the panel discussion and have some discussions. And we know Dr. Ruaga is still here to answer any questions, but also support us in our discussions. So at this moment, I don't think to see any questions. I would want to in a special way thank Dr. Ruaga for the very good note address that he has given us. As we get into discussing issues around access to capital, I want to invite someone, Andrew. Andrew is going to be taking up. I hope Andrew is on. Do we have Andrew ready?
I am on.
Yes. Thank you so much for coming. Thank you. And it's nice to see you. And thank you for finding time to be here. Would you just have a few sentences telling us who you are? You have some 15 minutes for you, what you do, and what your key message from the start should be.
Thank you. I hope you can hear me, Robert. Let me know if you can hear me.
Yes, we can hear you, but with some background noise.
What about now?
We can hear you. There's some background noise that keeps coming up.
Oh, I don't know why, but I can hear you perfectly well.
Please go ahead.
Good. My name is Andrew. I work with CCare. CCare is the largest private healthcare provider in Uganda. with 22 facilities across the country, and I'm very happy to be here as a general manager overseeing the supply hospitals. I'm glad have this to improve ourselves.
Thank you so much, Andrew. Thank you for being here and finding time to attend our webinar. Now, in terms of access to market, we all know that Uganda's health sector is growing, yet many businesses find it difficult to access capital. They need to scale up. In your opinion, what are some of the critical structures or barriers that are stopping private businesses from accessing capital to scale?
Thank you, Robert. You know, capital is the first principle of setting up a business or running a business. But healthcare businesses worldwide, and Uganda is not exceptional, they are expensive ventures. Apart from the element where you can start an individual clinic, but if you go to providing healthcare to secondary level, tertiary level, you will need a lot of money. Now, we need to set the background of how Uganda's private healthcare business started. Most of the private setups were started by individual doctors or individual families. Now, these have a limit to access to capital, and once they progress into secondary care or tertiary care, we have found that they reach a limit and they've had to either sell or to acquire more investors on board. The cost of providing quality healthcare is expensive. If you wanted to bring in an MRI, you would need not less than $1 million. Now, the question is there a need for an MRI in Uganda? Absolutely, yes. Then the second question is, how many people can afford to pay for an MRI? Not very many people. So if you walk to the bank and you told them that you would like to buy an MRI, they would say absolutely, because indeed they are needed. The bank would ask you, but how many people will access? When you do the math and your business case, you will find that you will not be in a position to fully service your loan and also look after other expenditures in your business. And then you'll be able to pay the interest. So the private capital, which is ruled by the banks, has stayed away from this market because it takes long to grow and return. And by the time it returns, these sort of institutions don't have a lot of patience. The other element is because the businesses are inherently being individuals, they don't have a global exposure or regional exposure to financing institutions that are dedicated to these kinds of fields that are of community good, and maybe they would charge a lower interest. So we've seen the IFCs of this world and the development banks of this world that are willing to invest in healthcare, but they require proper governance. They require proper books of accounts. They require a proper management structure. They require quality certifications. They require a whole framework of governance. Now, because some of our facilities or some of our businesses in healthcare have been individuals and we haven't paid so much attention to the governance, which is also very expensive to set up, then you find yourself that you have limited access to this kind of capital, which would be the alternative to the capital that is provided by the private firms. Of course, the question of the market We will continue to sing this song, but for as long as Uganda has not attained a national health insurance scheme, we will always have a limited market because very few Ugandans can access quality health care with their pocket expenditure. You might want to know that I think now Uganda and Burundi are the only, if I check properly, Uganda and Burundi are the only East African countries that don't have a national health insurance scheme. This is stalling growth. This is stalling investment. This is stalling access to capital because there will be limited number of people that can access health. Back to you, Robert. Robert, you there? Well, Robert, can you hear me?
Hear me?
Yes, I can.
Can you hear me? Good, good.
Yes, I can hear you. I don't know whether you've been hearing me.
I have been hearing you. The only challenge is the background noise, that there's still some background noise.
Okay.
But we can hear you. I think here, based on the submission, I really like the highlight of the challenges. And one of the challenges stated was related to the individual businesses. And before we start a business, there are issues related to investment readiness. In your opinion, what are some of the minimum conditions that a business must meet before approaching institutional investors to improve their capital?
Thanks, Robert. I've already said one of them. The biggest that you require is governance. Institutional big brands that give out capital would want to know the framework under which their capital or their money is rolled out, is being governed. So because very many of our companies or our healthcare institutions are still struggling to set up proper governance, have a whole management structure, have proper accountants and CFO for that matter, that are properly with the ethics, with the right training to make sure that the investment is protected. That's one of the biggest barriers. And I am an advocate for proper governance. We would love to see more Ugandan companies with proper governance. Some of them have gone out to find foreign CEOs, and you'll find that those would be more attractive to this foreign capital. That's
Yes, I think you bring out a key issue of governance, but related to capital. We have small businesses, with especially in the healthcare, and they are fragmented. They have different challenges. But in your opinion, looking at the different health subsector, maybe diagnostics or primary care, digital health, which one is a low-hanging fruit for investment right now to get capital that you could guide on the audience?
Diagnostics, absolutely. It's on diagnostics. I think Ugandans have traveled a long way when it comes to medicine. I'm sure wherever we stay, we don't have more than, in urban centers, you don't move more than a kilometer without finding a pharmacy or a drug shop. And then we have those small clinics, but we haven't yet scaled down to good diagnostics. Most of those pharmacies, most of those drug shops still treat people by the verbal symptoms that are presented and the history of the patient, but they are yet to have scientific proof. So diagnostics, these are not meaning MRIs or big CT scans, but things like ultrasound, X-ray, they need to become low-hanging fruits for smaller players that it would fetch them extra marginal revenue, and it would be easy for them to pay back to financing institution in a shorter time.
Thank you so much for that sharing. But you see, practically, in your opinion, what are some of the concrete practical steps that a healthcare entrepreneur seated in this room you would want them to take as a take home that in the next 12 months they can use to uh, uh, grow their capital as an entrepreneur?
First, a business of healthcare is like any other business. You have got to defend to attack. And I have seen that most entrepreneurs have been predisposed to finding new growth that eats into their working capital. So you must have working capital before you even think about growth. So protect your working capital, pay the doctors well, pay the nurses well, pay your healthcare well. Because we can talk about equipment and infrastructure, but people drive the business. Make sure that you have a good working force that is very well paid. They don't have to be highly paid, but they must be paid on time. And then grow your business organically. Do not try to do things for the big boys, because the big giants have CT scan, and then you would do it. Grow your business organically. Review data. Somebody has said that data is an asset. Review your data. What is your data showing you of the conditions that you are seeing already? Is there an opportunity for an X-ray? And go into that. Is there an opportunity for a good modern ultrasound? And go into that. Don't jump steps. Healthcare should grow organically, but not jump step and move from primary healthcare and go to tertiary. When you do that, you burn your capital, you will not be able to take care of your already existing business, and then both the existing business and the new business will suffer.
Wow, thank you so much. There's a lot in a short period of time as we talk about capital investment and the key message of growing organically, not just to skip, but also look at how data use as an important aspect. I think are some of my key messages. I don't know whether you have any three take homes for a person that
Thank
is
you, Robert.
listening to you. Yes.
Thank you, Robert. My take home, if I get an opportunity to speak in this forum, I'm very glad that you work in the Ministry of Health, and we continue to talk about this when we have the gathering, the Uganda Healthcare Federation. We need the government to step up the gear of getting Uganda Health Insurance Scheme. It will revolutionize healthcare. All of a sudden, there will be a big market with Ugandans are able to access decent healthcare. Right now, when we do make investments, we are not sure that we can have enough enough crowds that can join and harness our investments. Always happy to engage and looking forward to the rest of the deliberations.
Thank you so much, Andrew, and I hope you don't go off because we are expecting more questions going forward. But as we've talked about capital investment, I think it's important that it aligns with the next item of the panel, which is related to digital health adoption. We want to look at bridging the integration gap using digitalization. And the person to take us through this is Jude. Jude is a digital health innovator and a smart technology advocate. He addresses systematic integration barriers and explores variable partnership models for technology-driven healthcare transformations in Uganda. Jude, I want to welcome you. Welcome to this webinar.
Thank you very much, Robert.
Yes, it's always nice to see you and looking forward to this discussion. What would be like before even we start, when we talk about digitalization, what would you want as a key message for the audience that we should not miss out?
First of all, I want to thank you for the invitation. I represent an organization called Smart Applications International Limited. It's a leading healthcare ICT company transforming how healthcare access is delivered and managed through technology. We have been in this business for the last 22 years, going on to 23, and we've been managing through 12 countries right now. And we are at the forefront of providing end-to-end digital medical access and management solutions that provide easy, fast, and secure access. And of course, we're looking at the management of healthcare programs. It sits at the very heart of who we are in terms of what our vision is, and which is to create meaningful, human centric innovations for all. And that is the very premise of what we are about. So we innovate from the scratch. We do not use third party systems. We look at the industry and we address the requirements of the industry. And in terms of our ecosystem, we have been able to evolve over time, and this evolution has been based on a need on ground. And allow me to just take you through a profile of the four core areas that we are currently servicing. So we have our flagship product, it's called the MediSmart solution. And this has evolved over time from a desktop application to now a web-based application to what we currently have, which is called the Smart Access. And on the Smart Access, post-COVID, what we did was to do away with the use of a physical card to enable access to care be more seamless, because this has been a challenge across. And I believe for each one of us on call today, we do know that indeed COVID was an eye opener for most of the innovators. For those of us who are ahead of the curve, who were able to establish and ensure business continuity and access to services during this particular time. So, therefore, in terms of benefit verification and real time capture of claims, this is the demonstration of what we are able to do as SMART in those 12 countries. As we interacted with the medical service providers, we did note that there was a strong need for EMRs at the medical service providers. I do not have the specific data in terms of the current gap, but indeed the gap is there in terms of just having the EMRs to efficiently manage not only patient medical records, but also to be able to service a patient throughout that ecosystem, starting with the biometric identification, or even for facilities that have more than one clinic, how then do we ensure that you're able to capture the records from one facility across into another? You could be in Nakawa, but the other facility perhaps is in Gulu. How do you ensure without traveling all the way? And of course, with modules such as accounting and finance being embedded into it, including the human resource modules, indeed, we have provided for that kind of ecosystem for our clients. The previous speaker mentioned that data is indeed gold. And for SMART, we were able to leverage on this, and we came up with a solution called the Smart Business Analytics. And we are saying that with all the data that you have, what do you do with it? Indeed, it can only speak to you if it can enable you to make those decisions through having what we refer to as real-time data visualization and automated reporting through dashboards that will be able to tell you how is your business doing. And of course, there are aspects of modeling that can give you advanced analytics in terms of the health of your business. One of the innovations that we have been able to launch into the market and has provided a lot of value is what we call the smart EDI. EDI meaning the electronic data interchange. So this is an end-to-end data processing mechanism which is powered uh, by AI, and we do levels of claims adjudication. So, of course, there's always volumes of claims, and I believe for those of us who saw what happened to insurance companies during the COVID season, people were moving around towns between offices and homes, staff homes, carrying boxes and boxes of paperwork just so that they can be able to vet claims manually. So, what we have done as SMART is enabled our customers to vet these claims online rather than depending on paper. And in fact, the adoption rate has been great. We have specific payers that have fully adopted and are totally paperless. And right from the point of entry, where the validation of the member comes through, right to claims processing, that entire process has been digitized. So, in a nutshell, that's who I am, Judy Mugoya, based in Kampala. Thank you.
Wow, thank you, Judy Mugoya. I am really interested in understanding more about the MedSmart solution and the smart access that we've been seeing. But most importantly, the issue of data use. We are collecting too much data, and the how this data is used, and having a clear tracker related to what decisions are made out of this data. But since COVID-19, Uganda has accelerated its use and adoption of digital health tools. Yet integration into our systems remains fragmented. What is the single biggest systematic barrier to achieving this integration across Uganda's health sector today, based on your experience?
So, based on our experience, is the need for a national interoperability framework, because there are very many systems and they have been deployed independently, largely by donors and NGOs, because their key focus is very tunneled in terms of maybe they're looking at HIV specifically, or TB, or specifically on COVID. But we are looking at how do we then merge these particular that data that we are receiving into one particular platform that can then advise us accordingly. So that unification is really not there to be able to unify all these reports into one particular component. And then there's the element of standards. Yes, we are all collecting data, but where is the standard for this data that we are collecting? Therefore, the need for what I would refer to as a health information exchange is very, very important. I do know that we do have an e-health policy and a draft e-health regulation. However, in terms of the legal mandate and binding us in terms of the data that we're sharing, I believe it's an area that still requires a bit of attention, even as we look at how we can make these systems speak together. And of course, with the data that's being collected from the various silos, the issue of control still comes in terms of that data. How is it being used? How is it informing us, not only at a ministry level, but even as a country, as a sector, even as we make decisions within this country? And of course, these decisions impact not only the Ministry of Health, but we have the Ministry of ICT. We also have some interested donors who are still there, who are totally interested in the healthcare sector. How do we then get that information? Even private players like ourselves, as I have just mentioned, how then do we integrate into this bigger picture so that there's a proper representation across in terms of the data that is important to make decisions for this country?
Thank you, Jude. I think it's very clear we have gaps, and Like you said, the ministry needs to bring us together to have these standards and make sure that we have the health information. But you see, as facilities, as organizations, I think many facilities are trying. They have purchased different digital solutions, including different EMRs, billing software, diagnostic tools. But in most cases, they struggle to extract value out of them. Based on your experience, where is the adoption journey typically breaking down? Is it at specification of the, is it at procurement, training? Is it workflow, redesign? Where exactly is the failure to get value out of the different equipment that we buy?
So, thank you for that question. I'll speak from our experience. When we do go into any facility, our first call of action is to understand what is the pain point. And where the pain points come from could be an indicator of a challenge within the workflows. If the institution wants to duplicate the current workflow with its inefficiency, definitely they will not get value from it. Because if you're going to duplicate the same workflow process without looking at where the root cause of the challenges come from, then the value will not be realized. So the selection of the software, you need to be able to select a software that understands your particular needs and addresses those needs in a specific and efficient manner. There are many EMRs, but the EMRs are built on different standards in terms of workflow. So you're looking at a nurse's daily workflow. Is the tool cumbersome? Is it user friendly? And the other item when innovating solutions, you need to have the end user in mind. If you do exclude the end user in terms of the workflow, in terms of the dashboards that they will be seeing, in terms of the reporting, therefore, the value will not be felt because what is value? It is perceived. You and I have different standards in terms of what value means. And that's the same thing with EMRs. To what extent is it actually addressing your need? And then looking at technology adoption not as an expense but as an investment, because yes, it might be costly in the beginning, but think of the efficiencies, think of the value it's going to bring in terms of increase the revenue collection, because we have seen that happening where people have adopted the digital solutions and their revenues have gone up by more than 50%, just because it's closing gaps of inefficiencies as they go along. So the understanding of what the EMR is coming to do and involving those users absolutely is important in terms of demonstrating value.
Thank you so much, Jude. I think the issue of the readiness assessment, even before you start, is important. My keyword was pain point. What is the pain point for your organization or for your company, even as introduced? And yes, it's quite interesting. And I would want to encourage our those that are on the webinar. If you have a particular question, please go ahead, text it out, get ready to ask. Judy is here to answer all our questions, but also we share her experience with us. But as we share, Jude, what has happened before is we try so much to get into partnerships, and most partnership models seem not to be working. When we try to bridge the gap between technology providers and healthcare facilities, how do you structure a partnership so that it survives beyond a pilot stage? Because most of them die at the pilot for digitalization.
So when you're entering into a partnership, the key objectives must be clearly outlined from the get-go, because in a partnership you must have strategic KPIs that you want to be able to achieve as an organization. And of course, you must be looking at the return on investment. Shareholder value is one of the most important things that we need to look at anytime you're looking at technology adoption, because it's going to be a significant spend. But at the end of the day, the question is it serving your specific needs? So being very open about your ROI, being very open about your budget. Sometimes conversations do go on only for you to discover that the budget that was set is way below what the investment actually requires. And then working together as a team, because even as you sit at the table and you begin to work on a partnership model, uh, both parties must be clear and bring all matters to the table in terms of this is what is going to govern us. So governance is very important. The legal side is very, very important, so that even as you draw out your key objectives, you are very clear at the end of the day, what are those measurable outcomes and benefits for either party at the point when this partnership is actually ongoing at an operational level, and at a point when you're livening, so to speak, in terms of end user engagement. Maybe I'll just give you a simple example. The decision, for example, to go into a partnership model can be decided upon at a very high level, but the people on ground then will be able to see that partnership model in a totally different way. So that engagement is very important in terms of understanding to what extent is my particular role or engagement in this partnership model, how does it actually contribute to the success? Because those partnership models, they fail not because they did not understand the objectives, but at the implementation level, you find that there are different interests, so to speak. I'm trying to be very diplomatic there. So the interests become totally different. And when it's going to unearth certain things, you will find, therefore, there will be lack of engagement, there will be lack of sharing of information, which is very critical when you have a partnership, and that partnership must work because information must be on the table. That is my 3 cents about it. Thank you.
Thank you so much. I think my take home is about openness, budget openness, and then decision making. Decisions made
Absolutely.
at a higher level, but not passed on. Why do we do what we do? But you see, Judy, even as we get into adopting digital health, in Uganda, I know for you, you have stated that you are in Kampala. You have facilities online from Gulu, some are from Arua. I have seen some from even Nakaseke, where the connectivity and power infrastructure remains inconsistent. How are smart technology solutions being designed to function reliably in low bandwidth and low power environments in Uganda?
Okay. Allow me first to just give you a profile of where we are at. We're in about 900 facilities in Uganda in about 102 districts. So therefore, I mean, our footprint in Uganda is pretty extensive. And one of the things that we did commit to is support, because for the different regions, as you have said, the connectivity issues are different. What you will find in terms of your experience in Kampala is totally different from somebody who is in Kitgum or Koboko or wherever it is. So therefore, our solution provides different interfaces that allows continuity of care. Again, it goes back to understanding the need, understanding your environment. So we do have supporting structures. For example, we have a 24/7 call center that supports the medical service providers. There's what we call an off smart, which means that in areas where I mean, let's be honest, the connectivity issues are there. We do have mechanisms whereby there's an information or communication that will still allow that individual to access services using alternative channels that we have created for the members to be able to access services. Yes.
Okay, thank you so much. I think I have learned several things like off smart, even when the network is off, the data is kept and you are able to keep it. Uh, Currently, like we said in the earlier session, we talked about issues related to data being gold, and there are regulations about data security in the country. So, regulatory and data governance frameworks for digital health in Uganda are still maturing, as per your, opening statement. And as they mature, how should technology companies and health facilities be preparing now to ensure compliance once a formal regulation is enacted?
So, the fact that it is still maturing means that there still are global standards that you can actually use. And rather than sit, one of the things that we have done as SMART is to go for global compliance standards. And this is at an ISO level. Bringing it back home, I know that we do have NITA-U, and NITA-U has provided some guidelines on how we can actually manage data. And of course, it's not a given that you will go through without going through an accreditation process. And therefore, my encouragement to any organization is that yes, go through the regulations. The regulations are there, they are maturing, but it doesn't mean they're non existent. But indeed, compliance is very important, especially when you're dealing with sensitive data. Uh, Such as health data, which is identifiable, where you can identify Judy, you can identify a condition that Judy has, you can identify where she has gone. We definitely need to be able to comply to the existing structures that we currently have. And I believe, whether private or public, we should actually continue to work together to ensure that these standards are upheld. And upholding those standards simply means we need to play our part, play our role, and also be able to share our experience or share any challenges that we come across. Because NITA-U has been very, very supportive. I will speak from SMART's point of view in terms of accreditation, and this is a yearly thing that we do. So it is not just a tick box, but there is evidence you have to provide to show that you're actually compliant.
Jude, thank you so much. Thank you so much. And I think your discussion and submission have gotten someone to start considering, getting into digital health adoption. But as we conclude on this, in your opinion, if I want to start tomorrow or start today, what are some of the digital health what can I look at as the key issues I should look out whether a digital health investment is delivering value for before I start even investing in it?
I sort of lost you there a little bit. Do you mind repeating your question?
Oh, okay. So sorry. The question is related that as I look out, what are some of the key things that I should not miss out as I adopt a digital health platform in my facility that would give me value?
Okay, so it's going to be very similar to what we had mentioned earlier. What I had mentioned earlier is, first of all, define where you want to go, define what that technology is going to do for you. And when you have the matrix, allow me to call them that. So you have clinical outcomes which you're going to be able to map in terms of health improvements. Are you able to measure? I mean, you were at A, but you want to get to B. All right. Your clinical workflows in terms of the integration, is it making work easier or not? And then you have your business metrics. Are you making savings? Are you able to measure those savings? And to what extent has it had on your revenue? For example, how has it impacted your revenue and your operational efficiency? But also looking at the patient experience matrix, it's very important that you also measure items such as engagement, that is whether active or passive, because indeed you have to ensure that you're engaging with your patients and measuring their satisfaction scores. In our organization, we even measure the net promoter score. The net promoter score is just an indicator of whether this particular individual would be able to refer you to somebody else to say, actually, that solution actually works. So it's important for you to be able to assess your impact. And then, in as far as technology is concerned, look at items such as system uptime and the kind of data that you're actually getting, and the ability for you to be able to integrate, because you do not want your staff then using multiple systems, as we have been able to see in the healthcare industry. But the issue of interoperability is very, very key in health IT systems. And of course, issues of security and compliance. I cannot begin to re-emphasize the need for us to look at to what extent is that particular digital health tool secure and compliant. Yes, thank you.
Okay, thank you so much, Jude. It is, I don't know whether you will be able to share like some of the contacts. For some of us who want to be supported, want to get to the SMART. We have seen SMART all over, the business solution, the smart business analytics that can help me, get to know even how much my business costs, give me that value for money and the different solutions. Thank you, and I hope you are around to answer the questions as we end. And thank you so much once again, Jude.
Thank you, Robert.
Thank you. Yes. Now, for our audience, I will request that you put the questions in the chat. We want to compile them and be able to answer all of them as we conclude. But before, we had accessing capital access. And then we've talked about the issue of digitalization. Now we have an opportunity to see, Nevin is going to be taking us through the issues around scaling pharma and healthcare businesses. As I introduce Nevin is a pharmaceutical and healthcare business strategist. He focuses on governance frameworks, ecosystem collaboration, and market entry strategies that take businesses from survival mode to genuine expansion. Ladies and gentlemen, I want to take this opportunity to once again welcome Nevin as he leads us in the pharmaceutical manufacturing. Nevin, you are welcome.
Thank you, Robert. Good morning, ladies and gentlemen. I hope you can hear me. My name's Nevin Bradford. I have 40 years experience in the pharmaceutical industry, not yet date expired, I hope. That experience covers multinational companies such as GlaxoSmithKline, generic companies such as Cipla and Sun Ranbaxy from India, and consumer healthcare companies such as Pfizer and Novartis Consumer Healthcare. Now, one bitter lesson that we learned in the healthcare and pharmaceutical field over the COVID period was the fragility of African healthcare supply chains. If we cast our minds back, we can all remember the difficulties that Africa faced accessing the COVID vaccines, which were unavailable for some considerable period of time. And when they were available, Africa was at the end of the queue. Other healthcare commodities, such as essential life-saving antiretrovirals, and antimalarials were in some considerable shortage of supply during that period, so much so that one southern African country was within 3 weeks of a complete stock out of antiretrovirals for the treatment of HIV/AIDS. Significantly though, Uganda was not in that position at the time, as Uganda had and still has one of sub-Saharan Africa's only WHO pre-qualified and qualified manufacturing facilities in Quality Chemical Industries Limited, which was able to maintain continuity of supply of antiretrovirals and antimalarials to Uganda, and indeed assist neighbouring countries, including the one I mentioned in Southern Africa, to ensure that they did not go out of stock. Having learned the lessons of COVID, the local manufacturing of pharmaceuticals made in Africa for African patients has become and is top of mind for healthcare providers across the continent, and in particular in our context in East Africa. And here we're not just speaking about pharmaceuticals, we're speaking about diagnostics and other healthcare commodities. The reason being that even as we speak, and that the manufacture of pharmaceuticals locally has been top of mind for the past 5 or 6 years, still more than 75 and possibly as high as 80% of the pharmaceuticals consumed in Uganda are imported. Now that is declining, but declining slowly, but we have good reason to believe that the percentage of locally manufactured pharmaceuticals in Uganda will increase quite substantially over the coming years. Why do I say that? Well, now and in the next 2 or 3 years, we will see an exciting time in the growth of Uganda's indigenous pharmaceutical manufacturing industry. We are seeing some considerable investments in local pharmaceutical manufacture, the most prominent of which the several factory establishment at Day Pharma, which is a multi-million-dollar investment in several areas of manufacturing, and possibly one of the most ambitious investments currently underway in the manufacture of a range of pharmaceuticals in sub-Saharan Africa. And it's not going so far as to say that once Day Pharma becomes fully operational, the pharmaceutical manufacturing environment in Uganda and East Africa generally will be transformed. We're also seeing established manufacturers such as Kampala Pharmaceutical Industries and others such as Abacus, which manufactures intravenous fluids, building new facilities. Abacus's new intravenous fluid facility has recently undergone GMP inspection and I believe is now in operation. We also have the long-established WHO World Health Organization approved facility at Quality Chemical Industries, which is now investing in a new manufacturing facility. And of course, it is worth noting that Quality Chemical Industries remains the only publicly quoted pharmaceutical manufacturer in East Africa on the Uganda Securities Exchange. In addition, we're seeing new entrants, new investments from India in particular. Nightingale and others are either starting manufacture or are starting to invest in new manufacturing facilities. So across the board, from a pharmaceutical investment perspective, we are seeing a greater level of commitment and investment to local manufacture in Uganda than we have at any time in the past. Also, from an East African perspective, these developments are mirrored in neighbouring countries. Rwanda, for example, which currently has no pharmaceutical manufacturing plants, soon will have 3, including one vaccine manufacturing facility from BioNTech. And we're also seeing additional investments in Kenya, a vaccine manufacturing facility amongst others. So, an exciting time in the pharma manufacturing industry, and once all of these investments in manufacturing locally start production, we will most definitely see the 80% share of pharmaceuticals imported declining quite considerably. Whether we can get that below 50% in the short to medium term is a moot point, but most definitely that percentage will decrease, and the percentage of locally manufactured pharmaceuticals will increase significantly. That said, every pharmaceutical manufacturer in Uganda faces challenges. Of course, no business is without challenges. In particular, our manufacturing facilities face the challenge of scale. Ugandan manufacturers, and indeed East African manufacturers generally, are competing against international players with very large volumes. Batch sizes are much larger than Ugandan manufacturers can warrant, and also the Indian manufacturers in particular have access to locally manufactured APIs, active pharmaceutical ingredients. Indeed, some of the Indian players are what we call vertically integrated. In other words, they manufacture the API, the raw material, active pharmaceutical ingredients, right through to the finished dose product, vertically integrated companies. And they are strong competitors. Secondly, Ugandan manufacturers face a lack of what we might term pharmaceutical manufacturing infrastructure. Most packaging has to be imported. Currently, all active pharmaceutical ingredients have to be imported, and currently, nearly all, if not all, excipients which go into the finished product also have to be imported. We also face, of course, the cost then associated with these importations from India or China, or Europe for that matter, into a landlocked country. Thirdly, of course, and as has been mentioned before, there is an issue of access to affordable capital. The interest rates that lenders investing in pharmaceutical or indeed industrial manufacturing are quite high compared to peer competitor companies in other countries. Thirdly, we're looking at an issue of portfolio. With certain exceptions, the issue of technology transfer can be an issue for pharmaceutical manufacturers. By technology transfer, we mean the transfer of the skills, the knowledge to manufacture and create regulatory dossiers and pharmaceutical products. That is a challenge, of course, that every pharmaceutical company faces, but some currently either have an international partner or have access to technology transfer through other means. That is a challenge, but it can be done successfully. And last, but by no means least, of course, and this is an issue that every pharma company faces, every pharma company is only as good quality-wise as its last batch. Every batch, every day, manufactured day in, day out, must be manufactured to the same good manufacturing practice quality standards. It was thought 10 or 15 years ago, maybe longer, that this would be a challenge for African manufacturers. Of course, it is a challenge for every pharmaceutical manufacturer, but those present in Uganda and elsewhere have demonstrated consistently that African manufacturers can manufacture to GMP standards day in, day out. Now, how are we going to address some of the challenges that we face? Well, firstly, the market size. Uganda has a population of 48 million. There are no reliable, what we call ICVIA, or what used to be termed IMS market share data, but some work we did a couple of years ago, myself together with the Clinton Health Access, we established that the private market in Uganda is rather larger than has been thought, and that the BUBU, the Buy Uganda, Build Uganda initiative by the government of Uganda, has been successful. And if we look at the percentage of national medical stores products that are manufactured by Ugandan manufacturers, we will see a very high correlation between local manufacture and NMS purchases. In other words, BUBU is working. Less so in the private sector, where companies are open to fierce competition from India and elsewhere. But it will be fair to say that even in the private sector, local Ugandan manufacturers are making inroads and increasing their market share. How can Ugandan companies long-term increase their market share? Well, the way forward, I would suggest, is, and it is easier said than done, is value, not volume. If we look at the cost of money, if we look at the cost of capital, companies can be paying as much as 15 or 16% interest on capital borrowed. The margins on some bulk genericized commodities, such as paracetamol, for example, can be not much higher than 15 or 16%, 20%, for example, which means that the margin between the cost of capital and the margin made on pharmaceuticals, volume pharmaceuticals, is not that different, a capital trap, which must be avoided in the short to medium and indeed long term. Otherwise, there will be low profitability or negative profitability, and following on from that, a lack of funds available for future investment. How can we avoid this volume stroke, margin stroke value trap? The answer, of course, is to invest in tech transfer, to invest in products that have a high margin, and invest in differentiated products. By that we mean products that will have either a limited competitive profile or have added value, not bulk pharmaceutical products, which are basically low margin, high volume. These low margin, high volume products are very good for manufacturing volumes and contributing to fixed overheads, but they will not contribute significantly to profitability in the long term. Product diversification, in other words, value, not volume. Secondly, we do have to establish a mechanism for pharmaceutical companies to have access to affordable capital, as we've mentioned. 12, 15 or greater % interest rates can be crippling. We must remember that from a greenfield site to the first pharmaceutical sold can be as long as 2 years, and in many cases longer. Why? Well, because as well as the construction of the facility, pharmaceutical factories have to go through rigid and strict validation processes. Their manufacturing machinery has to be imported, installed. SOPs, standard operating procedures, have to be established. And at the end of the day, firstly, the factory itself has to undergo good manufacturing practice inspection and approval by Uganda NDA, and secondly, the products manufactured in the facility will also require to have both a regulatory dossier and, of course, approval by NDA, and indeed their equivalents elsewhere abroad if the factory is going to export. In this context, it must be said that NDA is very cooperative and helpful to local manufacturers, giving fast-track access to both inspection for the facility and also for approval of the marketing and sales dossier, the regulatory dossier. So there is great help and assistance from NDA, but that does not mean that these extended timelines go away fully. And for example, a factory manufacturing shoes or clothes can be in production 6, 9, even 12 months before a factory manufacturing pharmaceuticals. And this, of course, has cash flow, investment implications, interest implications, especially if companies are having to borrow at 15% or more interest rates. Secondly, companies in Uganda and indeed in East Africa generally need to be more outward-looking, to have greater collaboration with companies in India and elsewhere for the tech transfer of new innovative products, which can help companies get out of the volume, not value, or volume, not gross margin, stroke profitability trap. Thirdly, and this is an area where I have to say, in my experience, 12 years as CEO of a leading company here in the pharma field in Uganda, government and Ministry of Health support. I would say, in my honest, humble opinion, that the support extended by the government of Uganda and the Ministry of Health is the best to its industry in East Africa, in my opinion. Bubu is working well, as I've outlined. The Ministry of Health and the NDA are very supportive to the pharmaceutical industry. Offtakes for locally manufactured products for supply to NDA under Bubu and other schemes are in operation. And this is not just sort of lip service to Bubu or lip service to purchasing from local manufacturers. As I've said, an analysis of NDA purchases against local manufacture shows that this policy is being implemented and is being implemented successfully, and successful to the extent that it is a significant help to the local manufacturing industry in the pharmaceutical sector. Tariffs, well, the big T word is, of course, being used widely by a certain president. It must be said that every industrialized country in the past has imposed tariffs to a greater or lesser extent. Some may now have abolished those tariffs once their industrial base has been established and is strong, but I believe there is no case of a country successfully industrializing without some level of tariff support and assistance. And currently, there is a limited tariff support for local manufacturers. I think it's 24 products currently across East African community have tariffs on imported pharmaceuticals. We don't want that to go too high because, of course, there will be pricing implications. But if we look at the example of Ghana, for example, where the tariff and regulatory support to local industry has really significantly aided the establishment of a strong and vibrant manufacturing sector, pharma-wise, in Ghana. We must remember, of course, that pharmaceutical manufacturing is a medium to long-term investment. These are investments not for the next year or two. These are investments for the next 5, 10, 15, and 20 years. And those who are providing finance, and indeed those who are thinking of investing in the pharmaceutical industry, must bear that in mind. Having said that, whilst these investments are medium to long term, the healthcare market, of course, is a long-term investment. And with developments in insurance, the growth of a vibrant middle class in Uganda, we will see the overall size of the pharmaceutical market in Uganda increasing significantly going forward. And as we've heard before, this growth will be particularly in what we term non-communicable diseases. In other words, diseases like cardiovascular disease, diabetes, maybe CNS conditions and mental health, which are to a large extent chronic, which will increase partly due to better diagnosis, partly due to lifestyle choices, changes, etc. And it is vital that the Ugandan pharmaceutical industry addresses the growth and challenge of this non-communicable disease segment, diabetes cardiovascular. Here I just mention briefly the TRIPS issue, the trade-related intellectual property issue. Least developed economies, such as Uganda, Rwanda and Tanzania, have no pharmaceutical patents. So there is the possibility of local indigenous manufacturers manufacturing pharma products that are patent protected elsewhere. This has not taken place to a great extent so far because of challenges in accessing APIs, raw materials, but this is also an area which has quite significant growth potential for the Ugandan industry. TRIPS exempted products could be manufactured in India and sold on the local market and indeed exported to other TRIPS exempt countries such as Tanzania and Rwanda and Burundi. Key is firstly access to the raw materials and secondly to the regulatory and other dossiers needed to have these products registered for approval with NDA and other regulatory bodies. There are ways and means around this, and innovative Ugandan companies I know are already looking into the possibility of manufacturing TRIPS exempt products in Uganda. These added value differentiated products, allied with the volume products that I've mentioned, are the way forward for the pharmaceutical manufacturing industry in Uganda, I would humbly suggest. So, all in all, the prospects for a vibrant and profitable pharma manufacturing industry in Uganda are in place. We have a supportive government, we have a supportive Ministry of Health, we have a growing middle class. We now have a cadre, so to speak, of trained pharmaceutical industry people, which wasn't the case 10, 15 years ago. And we also have a market which is open for investment, and also, of course, for foreign investors. A critical factor is the ability to remit profits abroad. This should not be gainsaid. You know, there are other countries in the region where both access to dollars or hard currency and indeed the ability to repatriate profits is either limited or very, very difficult. That is not the case in Uganda, of course, and this does not just apply to the pharmaceutical industry. And that places a significant big tick in the yes box, I would suggest, when international companies are considering investing in a East African or African sub-Saharan country for local pharmaceutical manufacture. All in all, the industry is growing. The prospects are bright, I would humbly suggest, and I think we will see most definitely in the next 3 years, but certainly at a maximum time frame of 5 years, the percentage of pharmaceuticals manufactured and consumed in Uganda increasing from 20% to at least 40%, and maybe even as high as 50%. Thank you.
Nevin, thank you for the experiences and for the sharing. from the perspective, I think some of the key messages is that first and foremost, you have touched on the gaps, the opportunities that are available, but also looked at the different things that could be done. Uh, from my point, is the issue of the bubu. Buy Uganda, build Uganda. There has been an increase in the medicines on the essential medicine list, and the intention is to see that government is supported. And from Nevin's report, it's like Ugandan market is open for investment. However, there are opportunities around the communicable diseases, the gap that it does offer, but there's support that government has provided. I think this was one of the main take-homes, that the Ugandan government has provided enough support that has been extended to pharmaceutical industry, which is based on Nevin's presentation, the best in the region. And I think that's a key message. So we can't miss out on that. Maybe as Nevin, as we conclude on this session, I know there's a lot of support that has been done. And the different industries or manufacturers would want to get into producing for government of Uganda, because government of Uganda is the main market. But I don't know, has there been an assessment that has been done for the readiness to produce locally for the local manufacturers, that maybe new manufacturers could attach themselves? And finally, as you conclude, if I want to start manufacturing, based on your opinion, what is the first step?
Sure. So Boo is helping the industry. In this context, of course, it refers primarily to purchases by national medical stores. But of course, Boo can only operate if products are manufactured locally. You know, by necessity, if a product is not manufactured locally, National Drug Authority has to import. And the analysis that we did a year and a half or so ago indicates that if a product is manufactured locally, then a very high percentage, and in some cases 100% of NMS's requirements are sourced locally. But there are many, many products, essential life-saving medicines, which NMS purchases, which are not manufactured locally. And of course, it can't implement Boo because if they're not manufactured locally, how can it purchase locally? So there is an opportunity for local manufacturers to extend their product range to products that are currently purchased by NMS but are not manufactured locally, low-hanging fruit, so to speak. And also, the majority of those products would also have a market in the private sector. So that's one area where business can potentially, access low-hanging fruit in terms of Boo. In terms of access to capital, well, the pharma industry, of course, is at the mercy of interest rates and is at the mercy of also capital markets as well. The higher the interest rate, the greater the finance cost, and to a certain extent, the lesser the incentive to invest in expanding manufacturing facilities. So given the nature of the pharma industry, with investments being long-term and taking a bit longer to establish a good, solid cash flow in terms of revenue through sales, the issue of access to affordable long-term capital is probably more important for the pharmaceutical industry than the average manufacturing industry.
Thank you so much. Thank you so much. Just wanted to thank you for the opportunity, and maybe remind everyone who is on the call that even as we conduct this webinar, please don't forget to register. The Uganda Healthcare Market Tour will be happening in June from 1st to 5th, 2026. I hope you already have your registration ready. We want to showcase what is happening, and this is part of the preparatory activities that will be happening. In today's webinar, we had three themes of discussion. We talked about capital access, we talked about digitalization for health, and lastly, we talked about pharmaceutical manufacturing in Uganda. So Rahel, in case there are any questions that need to get out, maybe I'm unable to see the questions, you could put them out. Otherwise, if there are no questions, I would want to thank all our panelists and ask Dr. Luwaga just to give closing remarks as we close this webinar. Okay, I understand there are no questions. So Dr. Luwaga, just closing remarks within like a minute. Over to you, Dr. Luwaga.
Yes, first of all, I would like to sincerely thank Unique Global for coming out and partnering with the Uganda Healthcare Federation to prepare to conduct this forthcoming market tour of Uganda. I would also like to thank our moderator for, conducting it very well and being articulate. Thank you, Dr. Robert. To our the presenters, Nevin, Dr. Miriam, and Dr. Judy, thank you very much for eloquently addressing the subjects at hand. Well, Yannick, thank you very much. We first met in a very strange environments, but I'm glad that our meeting and our deliberations is promising to deliver something tangible for Ugandan private health sector. I sincerely also like to thank the Minister of Health, with whom we work very closely and who have put a lot of trust in us and are continuously improving our engagements, and possibly to my colleagues in the private sector. It's important that going forward that we do demonstrate the impact of our services, both to government but also to the public. And this afternoon we've been discussing data, among other things, how data is gold. I think we should really take this very seriously. I think maybe what I didn't touch is in our sector we have a spectrum of players. You have the large ones, you have the big ones, and then this goes right up to the grassroots. So I think as we think about how to on the inflection, we really need to think along this big spectrum to see what is it that we need to do for the big players, what is it that we need to do for what you can call the smaller players. Because our aim is equity. We need to make sure that we don't leave anyone out for us to be able to build this health sector in Uganda. So certainly we have spent some time here, but there are key messages that have come out that I would like to emphasize. Access to capital. What has been emphasized is the issue of governance, readiness, and governance. So that is something that we really need to work on. Many people, many players want capital, but are they ready? And if it came to governance, are they going to comply? So I think that is an area that we really need to work on to make sure that we support our players in this sector. Fragmentation is something that we need to fight as we go along. And our capital should be aligned to purpose. I think that message was quite clear. But as we scale, also we must scale with equity, putting in equity in mind. But one of the loudest call was about, I think, about the issue that we in Uganda we still lack the national health insurance scheme, and in order for players to, have a ready market or a sizable market, I think this is, we'll go back and dialogue with the Minister of Health. This is something that we need like yesterday. The low-lying fruits, I think we were told, is diagnostics. Then we were cautioned to grow healthcare organically. I think quite often we do make that mistake, and you want to run, even a baby first crawls and then runs, but we do make that mistake, but we've been cautioned. And then digitally, we need a national interoperable system. And then we must, as we source for these systems, we must align this with our needs and whether we'll be able to make profit. I think we've had very promising discussion from Nevin, giving us hope that we will be able to reduce our imports from 80% if we look at what he has promised. So basically, once again, I would like to thank Yannick Global. So Yannick Global, we have entered into an MOU, Yannick Global plus Uganda Healthcare Federation. And to our members, we call upon you to make sure that when the time comes, or between now and then, we take this opportunity to familiarize ourselves with what the tour is about. And then, given the challenges and gaps that we are facing, we should have a dialogue and then be able to also participate in the survey so that we can come out with areas that we need to address and then share with our international or forthcoming collaborators to be able to address this and move our private health sector forward, but most importantly, be able to complement government to be able to provide quality services to our population. I once again thank you, and would like to to say that thank you, and I move back to our moderator to guide us on the way forward. Thank you. Dr. Robert? Hello?
Patrick, for this very decisive concluding statements. And on behalf of Unique Global, I would want to say thank you to all the participants. A special thank you to the panelists for sharing your insights and your experience with us. This is an exciting preamble to what to expect in June, between June 1st and 5th, for the actual healthcare road tour in Uganda. And we expect the participants to have a much more insightful and deep dive into the topics that have been raised today. And we expect to see concrete and impactful solutions coming out of that discussion. We look forward to having you all on board for the June 1st to 5th road tour. And before that, we will be having a roundtable discussion on the very topics that we've discussed today with key sector players. We will keep you informed and also updated on that. And just as the chairman said, there's a survey that has been shared out to all members of the UHF and other stakeholders within the healthcare ecosystem in Uganda. Please kindly fill out the survey so that we can have very concrete discussions on your actual needs and your expectations for the June road tour that is coming up. I want to say thank you for joining us, and we are grateful for your presence, and we look forward to see you in June in Uganda. Thank you very much. Welcome.